One thing that can significantly influence synchrony with the ventilator, if you will, is inspiratory flow. And there are some significant consequences that can happen if inspiratory flow is not set appropriately. Can you speak to that?
That's absolutely right, Doug. If you don't set the inspiratory flow rate, then potentially the patient's going to be working harder for their breath. If they're working harder, their muscles will be working harder. It'll be scavenging oxygen from the rest of their system. So it's really, I think, paramount for the respiratory therapist to try and set the flow rate adequate to meet the patient's inspiratory needs. I think waveforms allow us to do this by simply quickly assessing what the waveforms look like. On the pressure time scaler, you will see a sort of a scooped out look if the patient's inspiratory flow rate's inadequate. And that's because as they're inhaling with such negative force, they're outstripping the flow coming from the ventilator. What you really want to see is a nice Sharkfin pattern that we have up on this particular graphic. The bottom one represents what you would hope to see, and the upper one shows that kind of scooped out look. So if we increase the inspiratory flow rate, what we hope to see is a change of shape in the waveform to a more shark fin look.
So Carl, before I let you move on to our next slide, I notice on this particular graphic that there's an inflection point following peak inspiration. For our novice therapist, could you interpret that for us?
Certainly, Doug. What those are is artifact that's caused by the ventilator circuit. As the ventilator circuit expands from a rapid breath, it contracts when it cycles into exhalation, causing that sort of artifact that kind of reminds me a little bit of the aortic notch you see on a cardiac waveform sometimes, or Swan-Ganz waveform that you would see sometimes. Just sort of the quality of the circuit. You got to be looking out for some of that stuff that's artifact and kind of recognize it for what it is. Otherwise, it can just drive you nuts.
It's mind-blowing that these ventilators are so sensitive they can pick up little twitches in the circuit. Quite interesting.
Yeah.